Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Welcome to Health for Life. Today we're talking with Dr. Ashish Kabir, board-certified neurologist with Hamilton Physician Group-Neurology at Vitruvian Healthcare System. Dr. Kabir, thank you for being here.
Thank you. I'm really excited to be here.
Today we're going to talk about Alzheimer's. For family members and those newly diagnosed, what kind of real-world strategies could help them maintain their independence and well-being?
I'm very excited to say that, there's so many strategies that patients and caregivers of Alzheimer's patients can adopt in order to strengthen their daily experience. Consistent daily routines have shown really great success. Using memory aids, whiteboards, calendars, checklists, alarms, your iPhone, or Android. I should say that. Any of these can be very, very helpful, especially with the new AI-based assistants that can help you. The one thing that's very important is to take large tasks and break them into small tasks. That can be very helpful. And encouraging familiar, meaningful activities such as hobbies, family engagement, that sort of thing can be very, very helpful as well. The other thing that I always will put in a plug for is physical activity, proper nutrition, and structured social interaction. These things are very important because what they do is they really kind of maintain activity, maintain overall health. So some really exciting things that you can do to make sure that we keep patients independent for as long as possible, ensure their well-being and also the well-being of the caregivers.
Yeah, that's right, and it's no surprise that being a caregiver is a pretty big job. How could caregivers take care of themselves?
Again, I'm very happy that you mentioned that. The way I always bring it up with my clinic patients is I always say, oftentimes as I see patients progress through their disease, the patient looks the same every time they come to the office. The caregiver looks worse and worse. Oh. So I think it's very important for caregivers to take time. This is a long game. It's a marathon, not a rush. Caregivers have to monitor and recognize the stressors that they're taking on. They really have to ask for help and resources. You have to make sure that they connect with local support, local and national, honestly, support programs. Use community resources as much as possible. Use respite care. This is definitely something that patients' insurances and other things can help facilitate. And it's very important to use all local services that are available. So day programs that patients really like. A lot of patients have community support groups such as church groups, for example, or other social groups, things like that. And then home health and therapists can be very helpful as well in order to assist caregivers doing their job.
Are there services at Vitruvian Health that can actually benefit, patients and families for this?
Definitely. So Hamilton Physician Group-Neurology is basically a part of a very comprehensive healthcare system that encompasses Northwest Georgia and South Tennessee. At Hamilton Medical Center, there are comprehensive support programs, including diagnostic services, therapy programs, multidisciplinary teams. And by that, I mean, physical therapists, occupational therapists. Our speech therapists have a cognition program that basically can help patients overcome their day-to-day challenges on a one-on-one basis. That can be very, very helpful. Basically, all you have to do is ask your primary care provider or neurologist to refer, or even just see if you can participate in these programs by yourself. So these are really important things. Your physician group, whether at neurology or your primary care office at Hamilton, can help you navigate these transitions. They will help you access these resources, and they'll tell you if things aren't going the way that they need to be, and guide you in the right direction as well.
How has technology developed over time in, taking care of patients?
I joked a little while about AI on your phone, but it really can be very helpful. I think apps, smart devices. One thing I really like is the ability, GPS devices in cars and, phones have become everywhere. They're pretty much most new cars certainly come with some sort of support for this. And then the other thing that technology is very good at is actually creating communities of people who use the technology, right? So caregiver support groups, patient support groups, and knowledge and correctly vetted information can be very, very helpful in terms of guiding what next steps look like. So very useful. The other thing that I found very useful in my practice is telehealth services can be super helpful in terms of making sure that patients are connected with on a timely basis. If you've got a very full practice and one of your patients is in the hospital and they want to see you to make sure that their medications are correct, you don't want them to wait 3-4 weeks to say, oh no, that was wrong, right? So a quick telehealth visit can really make that possible. So I think that our world really allows for those sorts of things. In fact, many of my patients prefer it. They find it a lot easier to just do a quick telehealth visit instead of having to find transportation that brings them in or, say, for example, one of the things that happens a lot is the patient will be in one place, but the caregiver will be at the office or at something else, and telehealth allows us to connect all of those people on the same call, even if they're not in the same room, and, reduces wait times, all of those things. So technology has been very helpful in making care more accessible overall.
I can definitely see that. And, I'm the same way where if I didn't have phone reminders, I would just forget everything.
Right.
Like I set a reminder and I know I will see that in like 2 days. No
shame in admitting this, I think. And it typically doesn't mean you have Alzheimer's or anything like that, just so you know. But I think that's just the way we live now, I think, right? Mm-hmm. Like, you want to remember to cancel a subscription or cancel a membership or something like that. You just put it into your phone and now you're not going to forget anymore. So, in fact, they'll probably automate it for you. Make a reservation at a restaurant, just tell your favorite AI assistant, please go ahead and do that for me, and it is done. It's an interesting world. What I really find entertaining is watching my 4.5-year-old interact with this technology, and how natural it comes to them, Yeah. The idea that they have to get up and press a button to turn off the lights. Why would you do that? Alexa, turn off my lights, or Google, turn off my lights, or Apple, Hey Siri, whatever it is. And I think that all of these technologies are, as they evolve, do make our lives a lot easier for sure.
Living in the home, how can they, make their home, ready for this, safer for people with Alzheimer's?
That's a very important question, I think. I think that, you really want to focus on making the environment as simple as possible. So clutter and basically excess things that may be needed someday, you want to put all of that as far away as possible. Mm-hmm. I think it really helps patients, get through their day. You want to keep the routine as much as possible. As the disease progresses, unfortunately, some patients may wander out or fall. So locks or alarms can be very helpful to prevent them from progressing, and into a state where if they fall or wander out, if they were to have an accident, basically these things can help prevent that kind of thing from happening. You want to prevent tripping hazards, and most importantly, you want to create a space where the patient is at peace, a safe space, with familiar items nearby and access to help. So this can be buttons that call somebody, or, basically a voice assistant that can call someone if you need to. Those are the things I think that are very helpful.
What is most valuable for caregivers and families? Like, what should they be seeking out if they just need professional help or advice?
I think the most important thing is to make sure that each individual aspect is addressed. So, of course, your physician is a really important part, but you want to make sure you use all your resources. So, I'd mentioned therapy and support. I'd mentioned specialists for specific health conditions, but also I think what's very important is just making sure that we address all of the pieces in terms of legal concerns. A healthcare power of attorney is very important. All of those things really need to be a part of the equation. So
just to make it overall just a smooth experience, I'm sure.
Yes, financial things. I mean, these are all concerns, right? As it's really hard to be at a point where you can't trust your brain, I think, and it's incredibly difficult because this patient comes into your office and you're explaining how their brain doesn't work work anymore because of a pathological process. Much easier to explain that your arm doesn't work anymore because you broke it or something, as opposed to this. But unfortunately, it's the reality for many of our patients and many of members of our community. And I think that doing everything we can to try to address the patients' and caregivers' needs is very important.
I think something like, because you mentioned that staying in an active lifestyle can just like help overall.
Definitely.
I've seen instances where like people who like play piano or like different stuff like that.
Definitely.
They can forget their own name, but sit down at a piano and still know how to play.
Isn't it amazing what the brain can do?
Yeah.
That's why I always say patients will come to me and say, should I do Sudoku or some other, something. I'm like, well, if you want to be good at Sudoku, you should do Sudoku.
Yeah.
But if you enjoy spending time with your grandchildren, I would read up more and look at more pictures of your grandchildren. And, you like painting, paint more. You don't have to, remember all the magic details that you were taught in art school, in order to draw, in order to get pleasure from painting. And, a lot of our patients as they progress through their disease, I think really hold on to those things and really do get simple pleasures a lot more. And I think there's definitely something to be said for that. I think it's all about quality of life at the end, isn't it? So.
Definitely. And you've given like a lot of just hope in all the shows that we've done so far. And do you see hope in this?
I really do. I think that I think my friends would tell me I'm a pretty optimistic person in general.
Yeah.
But I really do think there's some science behind the optimism here, and I think that's really what I'm trying to bring up today. That you do the things that make sense. Take care of the health needs, the legal needs, the financial needs, and the personal needs of the patient, and the patient does well for longer is the short answer, I really have seen, especially in this area of the country, much older patients do very, very well that have great support systems and great, access to the things that make them happy. That's what seems to really work. And I really do think that's going to continue. What we're going to do is add more medical technology and other technology to make those things easier is I think what we're going to do. You don't have to wait months and years to talk to your grandkid that lives 10 states away because, the FaceTime call is the exact same thing, whether they're next door or, far away, or the video call or message that you can just say, And I think that's really amazing. We live in a time where we take these things for granted, and it really wasn't like that even a few years ago, right? So.
Yeah, it's super easy to. I just want to thank you again for joining us and talking more on the bright side of things.
100%. I really think that, it is a great time. It's a hopeful time. And, I want to put in a plug that says, not only will Hamilton Physician Group-Neurology help you with this, but we are very excited to see you succeed in your Alzheimer's care and your memory care because it makes us feel like we're doing a great job and we love just taking care of your community. So it makes us feel good, too, to see you do well.
If you or someone you know is concerned about memory changes, consider reaching out to Hamilton Physician Group-Neurology. Visit Vitruvian Healthcare System's website at vitruvianhealth.com or call their office at 706-275-6121.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.